Welcome back to the final part of our three-part course on colorectal cancer screening. In part one of this training course, we explored the current burden of colorectal cancer in Idaho and the barriers as well as motivating messages to support colorectal cancer screening. Part two covered screening options, including at-home stool tests and colonoscopy. We discussed the advantages and disadvantages of each option. This final video in our series will cover the strategies that clinics and healthcare teams can implement to improve screening rates. The Community Preventive Services Task Force is an independent, unpaid panel of public health and prevention experts. The task force reviews research to provide evidence-based findings and recommendations about preventive services, programs, and policies to improve health. There are 4 primary strategies recommended by the task force that you and your clinic can implement to increase colorectal cancer screening rates. The 4 recommended strategies are provider assessment and feedback, provider reminders, client or patient reminders, and reducing structural barriers. Idaho is currently at 61% screening rate for colorectal cancer among adults aged 50 to 75. The goal is to reach 80%. Let's talk about each of the 4 recommended strategies to better define what they mean and how they can be implemented in your clinical practice to increase screening rates. To begin to improve colorectal cancer screening rates among your patient panel or within your clinic, you must first establish a baseline. Provider assessment and feedback can help you begin to understand where you are now, where you want to be, and how successful you ultimately are by looking at your data. Looking at your data may help you answer key questions, like how consistently are you recommending colorectal cancer screening to your patients? How many of your patients actually complete screening? Once you have assessed this information, you can set goals or compare clinics or providers to begin to make measurable progress in an effort to increase colorectal cancer screening rates.
Originally, we were looking at the UDS data from 2015, and we found that we were at 18%, and we're needing to begin to offer this test to all of our patients. Looking at all of our clinics, we found that we were not offering it very often to our patients, so we began looking at fit tests and how often they were being ordered, how often patients were refusing the order, how often they were being completed and also canceled. And that information was being reported back to our staff through dashboards that we have available. In March of this year, we introduced Pierre Le Pou, which is a stuffed poo, and it is displayed at the office that has the highest percentage rate of offered fit tests. And in an effort to have patients ask about it, it's displayed on their counter, the front office check-in counter, so patients will come in and ask, what is this all about? And our front staff have been educated to provide patients information regarding what the clinic has achieved in that month.
Collecting and sharing data related to a provider's or care team's colorectal cancer screening recommendation helps identify what is actually happening in clinical practice and gives a true understanding of current screening rates. Evidence from meta-analysis indicates that a practice can achieve an 18.6% improvement in screening rates by effectively using provider assessment and feedback. First, determine what data you should be tracking and identify the most effective channels to share that data with providers and healthcare teams to identify opportunities for improvement and track measurable progress. Provider reminders are internal reminders that alert a clinic or care team to recommend screening for a patient when they're in the clinic. Provider reminders can also trigger healthcare teams to conduct outreach to patients outside of traditional clinic visits. Reminders inform healthcare providers that it is time for a patient's cancer screening test or that the patient is overdue for screening. The reminders can be provided in different ways, such as in patient charts or during morning huddles.
One of the ways that our healthcare team knows that a patient is due for a fit test is the daily huddle that is completed prior to a patient being seen. That huddle report identifies patients who have not had a fit test or who have not had a colonoscopy, and they will offer the fit test during the patient's office visit. If for some reason the patient refuses that fit test, and we're moving that information onto the provider so that that the provider can again go in and reinforce the need and the importance of a fit test for patients.
Provider reminders are important not only for the provider, but the healthcare team. Determine what type of reminder system will work best for you to make sure each screening-eligible patient receives a screening recommendation when they visit your office. We've discussed 2 strategies that your clinic can implement within your own practice to increase screening rates. Both have been focused on the provider or care team. There are also 2 strategies that are client or patient-oriented. The first patient-oriented strategy is patient reminders. Patient reminders may be written like a letter, postcard, or email. Reminders may also be telephone messages, including automated messages. The reminder is simply advising a patient when they are due for screening. Patient reminders may be enhanced by one or more of the following: follow-up written or telephone reminders, additional text or discussion with information about the indications for, the benefits of, and ways to overcome barriers to screening, or assistance in scheduling appointments.
We began sending patient reminder postcards about a year ago, and after that initial postcard was sent, we did a patient survey and found that 78% of our patients actually felt that the provider giving information and speaking to them about the need for a fit test was more effective than the actual postcard was. But we still continue to send the postcard because we did feel that we were reaching a group of patients who may not be coming in to the clinic to be seen, or may have, since our last run of recalls, may have become eligible for the fit test. Our process for following up on fit tests that have been given out or ordered for our patients is 2 weeks after they've been given out, our support staff are calling the patients to follow up on the status of completion of those tests, and if they are not going to be bringing them back, we are documenting why they're not bringing them back and finding out what barriers the patients have to completing the tests.
A meta-analysis of 43 randomized controlled trials on multiple types of patient reminders that were used to encourage women to get breast cancer screening found that most were effective. The degree of improvement in screening rates from the different reminder types ranged from 13 to 18%. Many cues to action had impact, but the most effective types were those delivered actively via conversation with a person, either over the telephone or in person. Reminders have also been shown to be effective with colorectal cancer screenings. Mailed reminders plus personal phone calls significantly increased the return of stool blood test cards. 2 personal phone calls had more effect than 1 call. Advanced mailing of stool blood test cards with accompanying letters before the appointment increased the rate of colorectal screening significantly. Patient reminders can be generic to address the overall target population, or personalized with the intent to reach one specific person or group of people with a specific characteristic. Try out different types of patient reminders to see which type resonates best with your patient population. Any reminder is better than no reminder. The second patient-oriented recommendation focuses on reducing structural barriers. Structural barriers are non-economic burdens or obstacles that make it difficult for patients to access cancer screening. Interventions designed to reduce these barriers may facilitate access to cancer screening services by reducing the time or distance between service delivery settings and target populations, modifying hours of service to meet client needs, eliminating or simplifying administrative procedures and other obstacles. Offering screening in conjunction with other preventive services visits is an example of reducing patient barriers.
One of the other non-economic barriers that we found our patients reporting back was that they did not want to collect the specimen. They didn't want to have to touch their poo. So we have put together kits that include a container and gloves to collect the specimen for patients to complete the fit test.
Clinics have the opportunity and responsibility to help remove barriers to improve patient access to services. The fewer barriers standing in the way, the more likely a patient is to complete a screening. When it comes to improving Idaho's screening rates and reaching the 80% goal, it is important to know your baseline screening rate and routinely track it for progress. Reminders for both the healthcare team as well as for patients are 2 additional strategies to implement. Finally, identify and address any barriers that your patients may be facing. Thank you for joining us for the final part of the colorectal cancer screening course. We hope these videos aid you in your interactions with patients and improving screening rates for colorectal cancer across Idaho.